The medical school interview is one of the most stressful moments of a pre-med's career. And in this video, I wanted to tackle the different interview types, question types, possible approaches to these questions, as well as talk about a few tips and tricks that you might find helpful prior to and during your medical interview. Hey friends, welcome back to another video. If you're new to this channel, hi, my name's Emmanuel. I'm a first-year medical student at McGill University. And if you're watching this video and you haven't liked or subscribed yet, well, I think you should like and subscribe to the channel. Without further ado, let's talk about the various interview types. So, the most common interview types for medical school, at least for Canada, are the MMI, the panel, and the classic one-on-one. The traditional one-on-one interview consists of a face-to-face interaction with an admissions officer anywhere between 20 minutes to an hour long. And this interview typically involves answering multiple personal questions. So the classic questions that you think about when you're thinking of the medical interview, that interview format is the one that will tackle a lot of them. The panel interview is very similar to the traditional style one-on-one. The difference is that you could have a number of panelists, right? So maybe various admissions officers, doctors, even regular people that just have an input in your interview. And this is great because it actually reduces bias, because instead of having one person judge if you're a good candidate for medical school, you have 3 or 4 individuals. The MMI, or multiple mini interview, consists of a number of stations, anywhere between 6 and 12, let's say, that are 5 to 10 minutes long, depending on the school. And you'll be answering a variety of questions. So some of the question types that you may encounter include the personal questions, the scenario or acting stations, the ethical dilemma style questions, as well as the critical thinking, or as many pre-meds like to call them, curveball questions. So the personal questions are the most straightforward questions that you will get on a medical school interview. And these are the classic questions like, why do you want to go into medicine? Why do you want to be a doctor? Why are you interested in our program? Why should we pick you out of all the other candidates? Or what makes you a better candidate? What are your strengths? What are your weaknesses? My recommendation is the following. Make a list of all these possible personal questions, especially the most common ones, and jot down what you would say. How would you answer them? Maybe you don't even know how to answer them. The classic question such as tell me about yourself sounds much easier than it actually is. So write down what you would answer to each of these questions, and then day by day practice and start timing yourself. Now, I'm not saying to memorize word by word what you wrote down on that Word document, but what's important is that you have an idea on how to answer these questions, so that if they come up or they add a little twist to it, you're able to adapt and you have a good idea of what you want to say. And at the end of the day, you don't want to sound like a robot who just memorized their answer. You want it to be natural, okay? You want to express your interest in medicine and why you would be a good candidate. Okay, so the acting stations could be a little scary, especially if you're not used to them. And for example, you walk into a room and you see someone crying, or you walk into a room and you see 2 people arguing, and you're trying to figure out when's the best time to step in and, comfort the person or try and break that argument. A good rule of thumb for these types of questions are to actively listen and ask open-ended questions. And sometimes it's even good to summarize because that actually reassures the actor that you're listening to them and you've got a good grip of the situation. If someone's crying, that's okay. You can let them cry a bit. Reassure them that you're there for them, that you're willing to hear them out. If there's anything you could do to help them, let them know that. And usually that'll prompt the actor to start opening up to you, especially because you're being empathetic. That's what a physician literally needs to embody when they have to break bad news to a patient, for example. As for the two people who might be arguing, this kind of goes hand in hand with the ethical dilemma types of questions where there are two opposing parties, and oftentimes the answer lies somewhere in the middle. It's important that you actively listen to both parties. You acknowledge the pros and cons associated with each party's proposal, let's say. And then after you've gathered all of that information, you can summarize and then propose an alternative, propose a solution to these problems, or a compromise where both parties compromise and they meet somewhere in the middle. Oftentimes the answers lie there for ethical dilemmas, but sometimes also for these acting scenarios. Sometimes medical schools like to throw curveballs in their interview to ruin your flow or just to get a better idea of how you would handle pressure. And these questions can be anything, okay? But what's important is that you're able to verbalize your thought process. That's what they're looking for here. Is this person thinking about this question in a rational, logical, step-by-step format? Or is this person's mind all over the place? They're faced with a new problem that they've never seen before. They don't know how to answer and they're losing it. And that's not the goal here. You need to be composed. So to summarize, if you have a medical interview, first of all, congratulations, that's incredible. But now is not the time to slack off. You can be the best interview taker. I don't care. Make sure you practice really, really hard so that you can ace this interview, okay? You don't want to mess this up. If you have peers that also have an interview, work together, okay? This isn't a competition. In fact, everyone I practiced my interview with all got accepted to McGill, and we're all happy. We all worked hard and it all paid off, right? And that can be you. So that's my final advice to you. So thank you once again for watching this video. If you haven't liked or subscribed to my channel already, please do so. It's greatly appreciated. I'm loving all the support and positive feedback that I'm getting so far. And if you have any additional questions on the medical interview, you know that I'm just a comment, email, or DM away. I'll catch you guys in the next one.